to Good evening and welcome to Health Check right here, Top TV, Look and Live. How are you doing? My name is Grace Ntuku and welcome to the program. Tonight, we are focusing on diabetes. And of course, I'm hosting Dr. Nduku, an endocrinologist, to help us discuss this topic. Remember, we are live on Hope TV. We also live at Hope TV Kenya on Facebook and YouTube. Do you have any question for yourself or for your loved one who is suffering from diabetes? Please keep them coming. Our SMS line is 20933, that is 20933. You can also engage with us. Our WhatsApp line is 0708 222 323. We'll be looking forward to receiving your questions. Again, our topic is on diabetes, and welcome to Health Check this evening. Allow me to introduce to us Dr. Nduku. Good evening, Daktari.
Hi, Grace.
You well?
Niko salama sana.
Hey,
yeah.
How was your day?
I had a good day. A bit busy, but yeah, grateful to be here.
Okay.
Yeah.
Let's just start by helping our viewers understand who is an endocrinologist and what do they do?
Yes. Now, an endocrinologist is a doctor who works predominantly with disorders of hormones, one of which is diabetes because of a major hormone called insulin. So we handle a lot of hormone issues, not just diabetes, thyroid issues, other hormones, including pituitary, which are a bit more complex. And well, today what you're discussing is diabetes. So yeah, I'm happy to be here to talk about that. Thanks.
Okay.
Yeah.
Thank you, Dr. Nduku. So let's begin by defining what diabetes is and some of its causes.
Okay, sawa. So now, what is diabetes? Diabetes is a medical disorder that results in sustained elevated blood glucose levels. So it is a medical disorder, metabolic, meaning that there's a hormone issue that results in sustained elevated blood glucose levels. Now, worldwide, it is a very common issue. We are talking about an excess of over 500 million people worldwide, and that is rising. Over the next 2 decades, we anticipate those will be over 700 million people worldwide. In Kenya, it is still common, although the figures we have is about 4% patients with diabetes of our Kenyan population in terms of adults. But half of those who have diabetes within Africa and Kenya actually don't know they have it, unfortunately.
Oh.
So we would be dealing with data that may be underestimated because of that. And even for those who have it, only half are on treatment. So that is a big challenge we have. The causes of diabetes, maybe we can look at it when we are thinking about the 2 broad types of diabetes, because the causes depend on the types.
Okay.
The most common form of diabetes that we are dealing with in Kenya as well as worldwide is called type 2 diabetes. And this is actually 90 to 95% of our patients with diabetes.
Yes.
And is a disorder that increases with age. Yeah, so as you grow older, the chance of getting this form of diabetes is higher, and also increases with excessive body weight, what you'd call maybe obesity. Yeah, so this is a disorder that is characterized by an issue with the way the body utilizes one of the hormones within the body called insulin. Yeah. So there is a resistance within the body to the insulin that is in circulation. And this happens a lot in the setting of reduced physical activity, in the setting of excessive body weight, and also in the setting of a genetic makeup that predisposes someone to that kind of condition. So that is the most common form of diabetes. It is called type 2 diabetes. Yes. However, there are other forms. Type 1 diabetes is the second most common form, occurring in maybe 5 to 10% of those who have diabetes. Yes. And this form of diabetes now has been described to start in the younger. So you'd think about it as the one that would be maybe more childhood onset. And so for about half would present before they are 10 years old. So it would present younger. Unlike for the one we've discussed before, the type 2, for type 1, the predominant issue is the body is not able to make insulin. So this is a hormone that is needed that the body can't make. Why can't the body make the insulin? Because the pancreas, the cells that usually make insulin, are destroyed by your own immune system. Kinga yako yaani inaharibu those cells that are supposed to be making insulin. So you find that over time, initially, there may be a near total reduction in the amount of insulin, but over time, there is no insulin. So the treatment of this form of diabetes is actually insulin itself, the hormone that is lacking, which is available as an injection. Yeah. So other than these 2 main forms, there are other causes of diabetes. that would be in fewer numbers. One is gestational diabetes, the form of diabetes we see in second and third trimester of pregnancy in someone who didn't have diabetes before. So because of the hormones that the placenta within the pregnancy makes, you have resistance to insulin because of those hormones from the placenta. So the sugars keep rising and you have sustained elevated blood sugars. In addition to that, I've mentioned a lot about insulin and the pancreas.
Yes.
Yeah, so anything that destroys the pancreas, if you have an injury to the pancreas, we call that pancreatitis, or you have maybe cancer of the pancreas, the sugars can be rising because of that. Yeah, so you can have a direct injury to the organ that is supposed to be making this major hormone, so the sugars start rising, you end up with diabetes.
Okay.
Yeah, then finally maybe small number due to medications. There are medications that directly may make your body less able to use insulin and increase your risk of diabetes, such as steroids, such as some of the HIV medication, and such as some of the psychiatry medication. Yeah, so there are also medical causes of diabetes in smaller numbers. By far the most common, type 2.
Type 2.
Yeah, the one that occurs in the more advanced stage.
Okay.
Yeah.
Dr. Nduku, you've
Yes.
mentioned pancreas.
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 Yes,
And insulin.
Yes.
And what struck me is you said if pancreas is damaged
Yes.
or has injury,
Yes.
of course it will lead to the type of
you
diabetes.
can end up with diabetes.
What are some of the causes of pancreas being injured?
Okay.
Yeah.
Now, the injury to the pancreas that we call pancreatitis,
Yes.
and sometimes that can happen in the setting of drugs. There are drugs that can be toxic to the pancreas. You can end up with pancreatitis. And you can also have it in the setting of alcohol, especially alcohol that is taken in excess outside the 2 units a day for a man. I'll talk about what a unit is. Maybe that's a beer. So 2 beers in excess of that. Or for a female, one beer, more than that. So anything outside the normal intake, anything in excess in terms of alcohol can be a cause of pancreatitis. In addition to that, infections can also be a cause of pancreatitis. There can also be other imbalances within the body that can injure the pancreas, including imbalances of your salts and calcium and the rest that can injure the pancreas. So the pancreas is a sensitive organ.
Yes.
However, it is not a very common. When you look at the overall number of people with diabetes, I would call that maybe one of the rarer causes of diabetes. Yeah.
And just to say, for you taking alcohol, please stop. You get diabetes.
Yes, Grace. Thank
thing.
you.
A good thing to take alcohol. Just stop. We are willing to pray for you, and God is able to. Okay, so let's go to the 2. You mentioned type 1, type 2. What are some of the symptoms that one would encounter to be able to tell this person is having type 1 diabetes and this person is having type 2 diabetes?
Okay, so perhaps I would be able to start, because someone who really wants to know whether they have diabetes, that would be the first question.
Yes.
How would I feel if I have diabetes?
Yes. Yes.
As the sugars continue to rise, one of the key organs, your kidney, is able to filter these sugars. And this carries a lot of water volume, which is excreted in your urine. So you'd find that you have a lot of frequency in the amount of urine you're passing. This is common both for type 1 and type 2 as the sugars go up.
Yes.
So you can find that there is a frequency in the amount of urine you're passing, and the urine may be a lot.
Could
yes.
we be able to measure, as let me talk about ladies, we'll have taking a lot of water.
Yes.
And of course, a lot of water will take me to the loo. Trips.
Yes.
So how am I able to differentiate that?
If you know how your baseline has been, on average, maybe you're taking 3 liters a day. If you find you are excessively thirsty, so you are taking more volume than you can tell your volume intake has gone up.
Yeah.
That can be a red flag for a high increase in your blood sugar. So if you find your volume of intake, you're excessively thirsty, regardless of your age, or you're passing urine a bit more frequently than before, that can be a sign of an increase in blood sugar. Of course, there are other causes of increase in frequency of urine, but that is a sign that you would consider screening for diabetes. In addition to that, because you're losing a lot of your glucose in your urine, weight loss happens. So you can lose weight, and you can find that you're also excessively hungry because these calories that you're eating are actually being lost in your urine. Now, because of the absence of insulin, the muscle can't take up glucose as well from the blood. So you can find that you're fatigued. Your muscle you may have fatigue. Now, back to the question as to how you distinguish between type 1 and type 2 based on the symptoms. There are some acute emergencies as the sugars continue to rise that may be more common in type 1 diabetes. They may present with abdominal pain and decrease in level of consciousness. As there is a lack of insulin and that continues to proceed, the body is unable to handle the fat breakdown from the lack of insulin. And so that forms an excess of acids, we call that ketones.
Yes.
So that causes a medical emergency called diabetic ketoacidosis, which would be more predominant in the patients with type 1 in terms of they don't have any insulin in their body. Yeah, so that would perhaps be one indicator. Another is regarding the weight issue I had already mentioned.
Yes.
For those who have type 2 diabetes, the typical feature is that there is an excess in weight because we talked about insulin resistance. Their body is not handling the insulin that is in circulation. So the weight issue for type 2 is more of an excess weight. However, for type 1, we would see more dramatically perhaps that loss of calorie in the urine causing loss of weight. So those are the ones who present more with reduced weight as a result of the dramatic rise in your blood sugar. So you've lost a lot of your calories through the urine and you're losing a lot of weight. That is more type 1 kind of picture. Although this can still happen across the board. These are just simple in terms of a description.
Yes.
Yeah, so that's some of the key symptoms would be that. In addition, however, as the sugars continue to be rising for long, the other things you would see would be infections because your immunity may not be as good, including candida infections, urinary tract infections that may be recurring. There may be foot ulcers that are now not healing. And once the sugars have been high for long, you can actually end up with the long-term complications. This is the effect of the elevated blood glucose on your blood vessels.
Yes.
This include the effects like stroke. So someone may come with weakness on one side, deviation of the face due to vascular occlusion within the brain circulation. There are also cardiac in terms of heart effects of the elevated blood sugar, chest pain, breathlessness due to cardiac disease from the diabetes. And then the ones that are more commonly discussed, kidney disease from the diabetes, you may present with issues like leg swelling, your urine output has been gradually coming down, and nerve issues from the diabetes. There may be some numbness, tingling, pain within your distals, so within the legs, and then also the eye complications of diabetes. In the initial stage, you might just find that you're not able to see well because the front part, the lens, has sugar deposition. But as the diabetes continues, the small vessels within the back of the eye can also suffer some injury from the diabetes directly.
Yes.
And these are the more long-term complications. So this may be some of the things symptoms now. Someone may be telling you that they're feeling as a result of the high sugars. So there is a wide variety.
Yeah. And just to remind your viewer, if you're joining us right now, I'm hosting Dr. Nduku, an endocrinologist, and you're talking about diabetes. Do you have a question related to our topic of the day? Please get in touch with us. The numbers are right at the bottom of your screen, our WhatsApp number and also our SMS number. In a short while, we'll be getting to your questions or comment, or maybe you have a loved one who is suffering from diabetes and they need to tune in. Please share the link with them and ask them to ask any question that they have. And of course, Dr. Nduku will be glad to answer
sure.
you.
Thanks, Grace. Yeah.
Yes. So let's talk. We've mentioned about the symptoms, and some of the complications that come with diabetes, and I believe it's in adults. So how can a parent be able to pick that my child or my teen is diabetic?
Now, in terms of the symptoms that you need to be aware about, they are not very different if it is a child. You might find a child who initially was not wetting the bed, suddenly is passing urine a bit more, so they may be having things like bed wetting. And things like thirst. If the child is thirsty, you would hear, I'm asking for water, and you're wondering, this is not the usual. So the excessive thirst still can happen in children. Excessive hunger, although a teenager, you're saying this child is eating all the time. They are always eating, anyway. Yes. But excessive hunger, those kind of symptoms still can happen across the board.
Yes.
The things that would be red flags, particularly now seen a lot, is we have among the younger people below the age of 18 who have risk factors for diabetes. by virtue of having maybe a family history of diabetes, especially family history of type 2 diabetes, and then they have excess body weight, maybe they're overweight or obese, they also may have diabetes, so you need to be aware about that. Even though they have not lost weight, you can actually have a high sugar because of the insulin resistance we are discussing about, because the excess weight is an active hormone, produces hormones that counter your body's ability to respond to the circulating insulin. So you can have the sugars are sustained and they are rising. In addition to that, if you're having infections that are just not clearing, so you've had an infection treated, another infection is not clearing, wound healing, there's an impairment in the wound healing, you can find that the child may have wounds that just don't heal, particularly in the distals, in the extremities, in the legs, wounds that are not healing. Issues like visual blurring, anyone who has visual blurring, one of the things that usually would be checked for is the sugar, because again, as we've mentioned, elevated blood sugar may be deposited in the anterior part of the eye called the lens, which becomes blurred, so you can't see through it. Yeah, so you can have visual blurring as a result of that. These are the acute things. And then over time, children are not exempt from the chronic complications that come with diabetes. Yeah, so those things, including the kidney issues, including the nerve issues we've mentioned, the issues with the back of the eye, the retina, including the effect on the heart and the long vessels, large vessels, those things still can happen. If you have had diabetes for long enough, you will still get the chronic complications. It is really unfortunate, but it is true.
Okay.
Yeah.
Yeah. And you know, when I was growing up, I knew diabetes ni ugonjwa ya wazee.
Yes,
You know,
yes,
of the older, or people
Yeah.
who have added so much weight.
Yes, yeah.
From your practice,
Yeah.
is there a specific age you could say this age is prone to
Okay.
getting diabetes, whichever type?
Okay.
Yeah.
As perhaps would wish to say, diabetes si ugonjwa ya wazee. Diabetes can actually start at any point. Diabetes can start from a child, even from a neonate, a very small child, if they have a defect in their makeup in terms of their ability to produce or to utilize insulin. So it can actually start at any age, all the way to the older ones who we usually would have accused to get diabetes before. Yeah. So the screening for diabetes, we recommend at least from 35 years. And from the age of 35, at least once every 3 years. If your initial test was normal, you would need to continue screening for diabetes. And in addition to age, as the age goes up, particularly if you're going above the age of 65 years and even beyond, data from the West, from 65, the risk of diabetes is about 25%. So that is 1 in every 4. That's a pretty large number. Yeah. So age definitely has a big impact, and we are starting screening as early as possible. In addition to that, if you have other risk factors for diabetes, you need to recognize that you're, of course, at higher risk. For instance, if you have a first-degree relative with diabetes, if you have a first-degree relative with the most common form of diabetes, type 2 diabetes, your risk of getting type 2 diabetes is between 5 to 10 times higher than the general population. Degree relative. Is this your, maybe your mom? Is this your dad? Is this your sibling? So these are your maybe first-degree relatives.
Yes.
Yeah. So if they have type 2 diabetes, by the shared genetic makeup, you are at a higher risk of getting that form of diabetes, and that is the most common form of diabetes. And the other issues are the ones we keep discussing, and I'm sure you've raised also if there is excess body weight in terms of overweight or obesity. And if you also have the other issues that are associated with type 2 diabetes, such as elevated blood pressure, so you have been told maybe your pressure is an issue, so that increases your risk. If you have cholesterol issues, you are also at a higher risk. If you have had a previous pregnancy and were told you had diabetes in that pregnancy, but somehow you are told after you delivered there was no more diabetes, your lifetime risk of getting diabetes is high, up to 50%. So you need to keep following up on that and pick it up as early as it happens. Then for the ladies, there are conditions like polycystic ovary syndrome that are PCOS, that increase your risk of getting the diabetes because of resistance to insulin. Physical inactivity is another one. If you feel your lifestyle is sedentary, you're not exercising at least 30 minutes a day, which is many of us in urban settings, the risk of diabetes is definitely there. Yeah, so as you think through, if the risks are at least one, your age is below 35, but you have at least 1 or 2 of those risk factors, would recommend screening, And by screening, maybe I can talk about it.
I wanted to go there.
Yeah.
So as you explain to us what screening is and take us through the process. So as, for example, Grace walks in to see Dr. Nduku. So what's the process that will happen towards diagnosing that Grace has diabetes? So take us through that journey.
Now that would be interesting. Assuming Grace comes,
Yes.
yeah, a different Grace, not
A
this
different
Grace,
one.
not
Not
this
this
Grace,
one.
no,
Of
this one,
course,
this
not
can't be
this
this one,
one.
yeah. But different Grace comes and you are having the classic symptoms. So you're telling us about the urine issues that you've been having, the thirst issues, perhaps you've been excessively hungry, perhaps you've had unexplained weight loss, you're not sure how this weight is going with all the eating that you've been doing. Yeah, so you're not sure how all this is tying up. And the first step we would do, because you're already here, is to do your sugar at that point. Yeah, so this can be done even at the bedside with a glucometer. It doesn't need the lab, we do it. Sugar can be done at any point.
How is that process?
It is just a capillary, it's a small prick.
Okay.
And the glucometer is handheld, very tiny, and that can give you your current sugar reading. If that current sugar reading, Grace, is above 11.1, we say 11.1, and you have had those symptoms that are in keeping with diabetes, we can agree that you have diabetes. So in the presence of those classic symptoms, if the sugar is elevated above 11.1, at that time when I meet you, so we call that a random sugar, then you have diabetes.
Okay.
However, there may be another Grace, or I can call her Anne, who doesn't have those symptoms. So doesn't have the excessive urine, doesn't have the excessive thirst, doesn't have any weight change, has not had any change in her eating pattern, but comes in and the sugar is above 11.1. In the absence of those classic symptoms, if the sugar is above 11.1, we usually need at least one more test to confirm that you have diabetes. That other test to confirm diabetes, what commonly we would use is either a fasting sugar, so we can tell you, don't eat anything for like the 8 hours before breakfast. So just go sleep, eat your dinner, come in the morning before you eat. Let's do your sugar then. If that morning fasting sugar is above 7, that is in keeping with diabetes. So those two would confirm that that now Anne has diabetes. There are other ways of confirming, such as a 3-monthly average sugar that the lab can do. And then there is also a glucose challenge that is also done by the lab. So there are a variety of ways that can be used. The most simplest are the bedside tests, which can be done by anyone at any point using a glucometer.
Okay. Yeah. Is it something someone can do at home?
Yes. Glucometers now are widely available, and most of our patients with diabetes, if cost is not an issue, are able to afford glucometers and do measure their sugars. We call that self-monitoring of blood glucose, and we are looking at the treatment of diabetes. That is also key, so we'll discuss that.
Okay.
Yeah.
Cool. If you're watching us and you have any question you're thinking about diabetes, please keep your questions coming. Our questions coming. Our SMS line is 20933. Our WhatsApp line is 0708 222 323. You can also engage with us at Top TV Kenya on Facebook and YouTube. We're talking about diabetes, and I'm hosting Dr. Nduku, our guest today.
Yeah,
so you've told us about diagnosing it. So fine. Anne, we found out she has diabetes.
Yes,
Okay, Grace doesn't have.
Grace,
That's
of
good
course.
news.
Yeah, there's no way.
So,
that name is too gracious. Yeah.
So what's the first step that we take with Anne towards the treatment journey?
Okay.
Yeah.
So Anne came in and we have agreed with her that she has diabetes. We need to now approach the treatment of diabetes. And the treatment of diabetes is very broad. We'd look at it in two ways. One, there is the medical part of the treatment of diabetes. Then there is the non-medical, we call it non-pharmacological part of the treatment. The big chunk of the treatment is actually not the medication. It is the non-pharmacological part. So that includes, one, education about diabetes. Both Anne, as well as her family, will need education about diabetes. They need to understand what is diabetes. They need to understand how diabetes needs to be managed, what are the potential complications that diabetes can set in, how nutrition changes, how her lifestyle in terms of exercise changes, whether there'll be any monitoring that will be done, including monitoring of sugars. So that is usually the first step, education of both Anne as well as her family. Now, regarding nutrition, that is a very big arm because it's not possible to move ahead in terms of the management without involving and engaging that. For those who come in with diabetes, nutrition plays a very big role. There's a lot of discussion that goes into issues like what can I eat? what can I drink? Yeah, so issues like food portion size and how that impacts your blood glucose. And we usually use the standard 9-inch plate, and we can be able to discuss. For instance, the simplest way would be half of the plate is filled with non-starchy vegetables, only a quarter plate is protein, and a quarter plate is starch, avoiding the more refined carbohydrates, the ones that are likely to give you a very high sugar load.
Okay, give us
Things
an example
like,
on the
for
plate.
instance, if you're taking your ugali,
Yes.
if you can lean more towards the one that looks most like maize, the one that is not
Isiagiwa.
yes. And
The
then the
portion meal
portion is, yes. And then the portion is the size of your fist, eh? Yes. So that's a quarter plate. It's not a large one. Eh?
Okay.
Then you choose whatever protein you're going to take. Your greens, when you say non-starchy greens, are the standard greens. Whether it's traditional vegetables, your sukuma wiki, spinach, those greens are all fine. They don't have much by way of starch. Then in addition to that aspect, the amount of the things like now fat, whether it is more using medical terms, what we say is saturated fat, the ones that are solid, those ones are less healthy for the heart.
Okay.
So we use the ones that would be perhaps the liquid vegetable oil, and then lean more towards other sources of fat that would be less likely to give you heart complications, such as nuts, fish. Those are more healthy sources of fat. So you're very cautious about the quantity as well as the choice of the type of fat that you're using, because diabetes is already increasing your risk of those issues. And then because of pressure and the complications that come with that, the salt intake is also guarded. So you're not adding an added amount of salt. About what you will drink, the sugary, calorie-rich drinks, typically things like the soda and the juices that are added sugar, you're cautious about that because that increases the amount of calorie, and the weight is a big challenge in terms of insulin resistance. So you're cautious about that. And then moderation in alcohol, that one we've already mentioned. So
and you said you leave alcohol.
If you can avoid it, that
avoid completely.
Better. Yes, yeah.
Yes.
So nutrition is a big chunk, of the management. And then exercise is a third arm, you'd say, in terms of the non-drug treatment, non-pharmacological treatment. Recommendation at least 30 minutes a day if you can, and don't miss 2 consecutive days without exercise. Okay. That improves your body's sensitivity to the amount of insulin that is in circulation. So over time, you might find that you are more responsive to the treatments that you're getting. And we call it moderate intensity exercise. So if you're walking, you're not just walking at a slow pace and saying it's exercise with your friend as you chat. No, it is a rapid pace. Yes. And cycling if you can. If you can be able to do more vigorous exercise, such as jogging or such as maybe aerobics, that would even be better. Yes. Yeah. So other than nutrition, we've talked about diet with Anne, we've talked about her exercise regimen. The other thing now we need to discuss before we start the medication is discussing the monitoring of her sugar. Okay. This is readily available using a glucometer, which is able to measure the glucose that you get, the amount of glucose in the blood that you get on a finger prick. Yeah. That gives us an idea of whether she's meeting her targets or not, and also enables her to monitor her diet, because what you eat has a big impact on the sugar you get. Yeah. So the glucose measurements can be used to monitor the amount of carbohydrate and the sugar you're taking. So that part we have addressed, non-pharmacological. Now in terms of medication, this is the part Anne maybe would be most interested in, or Grace is most interested in. Yeah. So the most common medications, maybe we think about them in 2, in terms of insulin, and then the other arm is the oral glucose lowering agents. That is the oral treatment. So either insulin or the oral treatment. There are people who come in and must be given insulin. For instance, the type 1 diabetes, as we mentioned, there is, in that state, the body is not making insulin. If it is making, it is making very little. So the body needs the support of the insulin injections in that case. And then those who come in with overt classic symptoms. So you've lost a lot of weight, you're having excessive urine in large amounts, perhaps very severe infections. So these are the classic symptoms, but they're very severe. Insulin is usually needed in that state. Other forms of diabetes, such as the gestational diabetes in pregnancy, because of the tight control that is needed, often will need the support of insulin. And then also in the setting of complications of diabetes like kidney disease, often will need the support of insulin. Yes. Yeah, because that time the control needed may be a bit more challenging. Yeah. Then in addition to insulin, now we talk about the oral agents, the oral drugs. Right now we are grateful that there are newer drugs that reduce the chance of progression, worsening of complications of diabetes like kidney disease, like stroke, like heart disease. And these are new drugs that have been in the market now. And I would wish to use a medical term for them.
It's okay.
Yeah, we call them sodium glucose transporter inhibitors.
Yes.
Yeah, so they are available, and even in Kenya now they are widely available. In addition to these newer drugs, the older drugs that have been used for long that improve the body's sensitivity to insulin and also increase the amount of insulin the body is making are also widely available. So there is a wide range of drugs that can be used in terms of the oral drugs. I would also wish to mention that the oral drugs, there are some that also have a benefit in terms of weight reduction, because weight is a key component, particularly for those who come in with excess weight and type 2 diabetes and resistance to insulin because of that. Yeah, so there are drugs that target both the diabetes and the weight issue, and that is a win-win here.
Okay.
Yeah.
Wow. I'm glad to hear there are so many options.
Yes,
one
the
thing that
options
struck me is
Yeah.
it begins with the non-medical. Allow me to use the term. The non-medical,
yeah,
which
let's
are
start
practical
there.
things you can do. You can watch
Yes,
your
yeah.
weight.
Always,
you can watch
always.
what you're eating.
Yes,
you can
yeah.
exercise.
Yes,
You know,
yeah.
those are things we can do and
Yes,
challenge
yeah.
each other at home to do.
Yes.
I wanted to ask, what are some of the myths you've had when it comes to diabetes, especially on the things to eat and not to eat?
Wow.
Or any other myth you've had?
Okay, there are very many myths that people come with. There are, particularly in the current setting, in terms of the treatment of diabetes, a lot of myths that people come regarding, one, the fact that you can just take a supplement and hopefully that will be the end of the treatment. You might not need treatment again. That is a challenge because sometimes it comes in when you have encountered someone who maybe have had a milder form of diabetes, perhaps even early diabetes, what we call pre-diabetes, and they were told that was the end of the diabetes, yeah? So that means they maybe didn't understand whether or not they really had and what kind of issues were around that. So by the time you go and take your supplements and come back, the challenge is you may have complications already and maybe even lost valuable time in terms of the progression and what can be done. I think that's a big one. We encounter it a lot as doctors. Yeah, and then also what Google says,
Dr.
So
Google.
anything that Google says is considered to be,
Yes.
Yeah.
You've mentioned about Dr. Google.
Yeah.
You know, you just type, I'm feeling these symptoms.
Yeah, very
Then
simple.
Dr. Google says up. Then
and come up with a
we rush
treatment.
to the chemist and buy. So
I know.
can one self-prescribe medicine on their own based on what Dr. Google says, especially when it comes to diabetes? And what's the danger of that, self-medicating?
It is a challenge because every treatment for diabetes is individualized all the way. So there is no standard prescription that can actually fit everyone. Yes. Each patient is treated as an individual when it comes to the approach to diabetes. There are so many things that go into the prescription, including what other issues, comorbidities you might have. One person might have diabetes alone. Another one may have diabetes together with pressure, together with lipid issues. Different results in terms of kidney, different weight, different diet, flexibility. So there is no way a particular prescription that is picked or dropped from Dr. Google can be able to be copied and duplicated, and you anticipate that you'll have exactly the same results between Anne and Grace or, each of the two.
Is different.
Yes, each of the two is different,
So, allow us to sample a few questions that have come through, and our viewer, we really appreciate you for writing in.
Yes,
Let's begin with this one who writes and says, how can a pregnant mom prevent diabetes? How can a pregnant mom prevent diabetes?
Okay. So the assumption we are getting here is that our patient here is not diabetic. So she did not have diabetes. Yeah, so she has come in and she's pregnant and is concerned about at some point she may get diabetes. Some of the things that have been key for prevention of diabetes outside pregnancy also do apply within the pregnancy setting.
Yes.
Yeah, so looking at the diet, in pregnancy you have many cravings. Perhaps you're craving the high-calorie drink that is very rich in calorie, but also may increase your weight gain in pregnancy. Yes. Weight gain in pregnancy has an association with the resistance to insulin, because excessive body weight is an issue. So if your diet is an issue, that would be something that you can definitely look at. And physical activity applies across the board. The physical activity that we are discussing is not only for someone who is not pregnant. If you're pregnant also, you do need to keep up in terms of physical activity as much as you are able to. The screening for diabetes in pregnancy is one of the things that I would wish to raise perhaps for this viewer.
Yes.
Because between the gestation of 24 to 28 weeks, it is standard that you're screened for diabetes in pregnancy. This is done using a glucose challenge. So this happens is you go to the lab in the morning and they do your sugar, give you some glucose to drink, and then do your sugar again over 2 hours. And this can be able to diagnose whether or not you have the form of diabetes that comes in second and third trimester of pregnancy.
Okay.
So I would recommend in terms of the physical activity, the diet, being keen on diet also, and then also the issue of screening, early screening. So that if it does happen, it is picked as early, and to avoid the complications that would come, like a large baby, hypertension in pregnancy, low sugars in the newborn, if the diabetes is not diagnosed or managed appropriately.
Okay.
And then also now beyond pregnancy, making sure that you continue screening and keep up with the same issues we are discussing in terms of prevention. It's not just a one-time thing and that's it, you're done, yeah.
Okay.
Yeah.
Let's tackle a few more that have come in. Dr. Fiona here, if the eye retina is damaged due to diabetic type 2, is it possible for it to get well or get back to normal?
Yes. Yes. So, Fiona, hi. I think that is a very important question you are raising. Now, regarding the eye, there are various stages that happened with that retina being damaged. Sometimes it can actually be in the very earliest stage. So what happens with the retina when you have diabetes of a long duration, there is injury to the small vessels of the eye, that part of the retina, and that injury interferes with the blood supply to that part of the retina, and with time there is lack of blood supply to some regions of the retina. That is called ischemia. So the body responds by forming new vessels. This is the more advanced form of the retinopathy. So the body may form new vessels to supply blood to that area that wasn't getting enough blood supply. In the earlier stages, there are injections as well as laser therapy that may be used to provide cure. And even as the disease becomes more advanced, there is management, including surgery. This is done by a specialized team, the ophthalmologists, and there is definitely hope. However, I would recommend that screening is key. For the eye, screening is key to pick it as early as possible. This is done by retinal photos that are done for the retina using a camera, and this can pick the earliest stage, and intervention can be done to prevent it reaching the later stages. And in addition to that, good sugar control, controlling the blood pressure, controlling your lipids, cholesterol if they are high, because all these are working against the retina in terms of the healing. So you can't tackle the eye in isolation without tackling the sugar control, without tackling the blood pressure, without tackling other things like the cholesterol. Yeah. So it is something that definitely can be managed.
Okay. Thank you, Fiona, for watching.
Thank you. Thanks, Fiona.
Another one says, what kind of food should a person with diabetes type 2 avoid?
Wow. Okay. Yeah. So thank you. We appreciate your questions. I would wish to say that in terms of the diet management, particularly for the most common form of diabetes, that is diabetes type 2, some things are key. The biggest factor, perhaps we would say, would be the ones that are, one, rich in sugar, and perhaps processed, in terms of processed foods, the things that give you a higher raise in sugar for a small amount of food. We call that a high glycemic index. So you take a small amount and the sugars really go up.
Like which ones?
Because, for instance, if you're taking cake, biscuits, these are already processed and very rich in sugar.
Yes.
Yeah, so those are not things that would be ideal. In looking at it broadly, the portion size matters. As we discussed the plate model, ideally we would be talking about more of the vegetables in terms of non-starchy vegetables, a quarter of protein, a quarter of starch. But there's a lot of it is an individualized diet. It's not something that is like cast in stone for everyone. Okay. Yeah, so the other things that we've discussed are more of the healthier fats, which we've discussed. So the unhealthy fats, including the solid fat, animal fat, those increase your risk of the heart issues in terms of cardiovascular. And then sugary drinks are a big culprit. So as you look at what you eat, you also think about what you're drinking. So if the drink is very rich in sugar, high in calorie, it is likely to give you a very high rise in sugar. It's not something you're going to take, for instance, a soda or a glass of juice that has added sugar in it. Yeah?
Okay.
Yeah. There is, however, a very wide range of diets within this that are an option for someone who has type 2 diabetes, whether it's an issue of the amount of carbohydrate you'll take, the amount of protein, in terms of the amount of calories you're taking, so long as you're able to attain good sugar control and weight that is a weight reduction that is ideally at least 5 to 7% of the initial weight.
Yes.
That helps a long way in reaching your goals for the sugar and in terms of your heart risk and heart protection.
Okay.
Yeah.
Okay. What I've heard you
So
say,
the
Doctor,
emphasis,
is
yes,
personalized.
it is individualized.
Diet.
It is individualized.
Diet.
It's not one shoe fits all.
Okay.
There's no way. Working with a nutritionist makes a very big difference, by the way. If you can have access to a nutritionist,
Yes.
that also does make a very big difference in terms of the diet planning.
Okay.
Yeah.
Sawa. How often should a person with diabetes type 2 go for medical checkups? And allow me also to add, even if you're sure you don't have diabetes, how often should you go for checkup?
Okay. Now, if you have type 2 diabetes, some things are required to be done a bit more frequently. For instance, okay, one, this is also an individualized answer because you can't give the same answer for someone who has type 2 diabetes and no complications and someone who has type 2 diabetes and already has, say, the renal complications or heart complications or has suffered a stroke from it. So it can't be the same in terms of the number of reviews you need. If all is well, you've not had any complications, some of the things that need to be kept up with include your checks for how the glucose is doing.
Yes.
That is your 3-monthly average. Yeah? That is the HbA1c. We call it glycated hemoglobin. That is done usually at least every 3 months.
Yes.
Gives us an idea of how the sugar control is. Even if you might not have done most of your daily sugars, gives us an idea of how the sugar control is doing. In addition to that, the other checks include your kidney function is checked both in the blood as well as in the urine. In the urine, we look for protein leak. Yes. That is as a result of the injury of the small vessels of the kidney from the markedly elevated sugar. So this needs to be done at least once a year, so you're keeping up with that. So you're doing your 3-monthly averages for the sugar. You're doing your screen for the eye at least once a year. You're doing the monitoring of your cholesterol levels also. If they are within check, you might not need to do them at least more than once a year. But if they are not hitting target, sometimes they need to be done again after 3 months. Yes. So you see, it is not possible to say that you will only be seen once or twice a year. It depends on what the results look like, what your sugars look like, and then also what you're feeling. Because you might be having no issues, but then also you might have issues. You might have issues from the diabetes in terms of the complications of diabetes. Okay. So all that impacts the frequency. And then in the presence of an ongoing issue, for instance, if you have a renal issue from the diabetes or a heart issue, sometimes you find you are seen much more frequently. There are patients we see on a weekly basis, particularly for those who may have more chronic issues, more like the kidney, stroke. You might find the reviews may be a bit more frequent than that.
Okay.
Yeah.
One more. Can a drastic cut down of sugar intake tamper with insulin and cause diabetes? Drastic cut of sugar.
The biggest concern with drastic cut of sugar, if you are taking a large amount of insulin, a large amount of sugar, and then you suddenly stop. If you didn't have diabetes from before, the body is actually able to regulate its hormone and reduce the amount of insulin to normal. So you won't have a drop in sugar. It will actually just be fine. However, if you have absence, if you're not eating anything, you're at risk of a sugar going low. That's now the opposite of diabetes. It's called hypoglycemia.
Okay.
So yeah, so sugars can go up, but they can also go low. Yeah. So I would wish to confirm whether he had a high sugar before when the diet was high.
Yes.
Yeah, but sugars, if you stop, your diet is not rich enough in carbohydrate or you're not taking any sugar, of a prolonged duration, especially for intermittent fasting or fasting for long, you can have a low sugar.
Okay.
Yeah, so there's a chance of a low sugar, hypoglycemia, a sugar below 4, that is.
Yes.
Yeah, with lack of, if you're not taking any starch or anything like that for a long duration. Yeah, so
sugar is not that bad, eh?
Ah,
Just
everything in moderation,
Moderation.
everything in moderation, everything in
Okay.
moderation, Grace. Yeah.
Thank you, Dr. Ari.
Yeah.
Fiona is asking, how do I protect or take care of myself against getting diabetes?
Okay, that's an excellent question, Fiona. Thanks for asking. I think that's a very pertinent question for all of us.
Yes.
And there are some things that you can do to protect yourself from getting diabetes. Now, we have already tried to look at the risk factors for diabetes. So one of the major ones that we've looked at include lifestyle, including exercise, including the diet. So for the diet, some of the things that are key in terms of prevention of diabetes would be looking at portion sizes and self-monitoring in terms of having goals regarding each of these, because we have already discussed what an ideal portion may look like, and monitoring to see whether this is attainable, and eating with the long term in mind, not just the short term. Every time we plan our diets, thinking about the long term in mind. And then incorporating exercise into this, if possible, at least half an hour a day, if we can manage. For more vigorous exercises, we can reduce the duration a bit. Now, the evidence in terms of prevention, particularly if the weight had been an issue, is that if you're able to attain a 7% reduction in your initial weight, you can actually be able to prevent yourself from going into diabetes, and that is something that is attainable. If you're having a challenge attaining this reduction using exercise, using diet, you can actually approach your doctor, because there are medications that can help prevent diabetes. This is one of the diabetes medications called metformin, and it is used for prevention of diabetes, particularly Fiona, if you've had a previous episode of diabetes in pregnancy and you're wondering, how can I prevent myself from getting type 2 diabetes? There may be a role for medications such as metformin for you. And then also, in addition, if your weight is high, we measure that using the body mass index. If it is above 35, there may be a role for metformin in addition to your diet and exercise attempts at preventing yourself from getting diabetes. I would also wish to advise Fiona that there are newer medications now that have been used actually for a while to tackle the weight issue only and prevent you from moving into diabetes. So this is not diabetes medication, it is weight medication. Yeah, that can be used. And as a last resort, even surgery, bariatric surgery is an option. Yeah. So there are many options for prevention of diabetes. Yeah.
We have to call it a day right here, but you've not talked to the most important people in the lives of a patient who has diabetes, the support system around them. So how can a family member support if one of them has diabetes, or how can children support their parents if their parents have diabetes?
I think that is one of the most important questions, Grace, you're asking.
Yes.
Yeah, and I would say, as we discuss all these things, one, there is, of course, the emotional component of having the weight of diabetes. It may be extreme. Some people even have what we call diabetic distress, a very strong emotional response to that. So there is the encouragement and the hope part. Yeah, that one would be definitely important.
Yes.
But from a medical part, I would consider the support in terms of ensuring, one, that their follow-up is adequate, that they are able to do the things that we are discussing. So if you can be able to provide support in terms of ensuring that your family members' sugars are monitored, ensuring that they are able to do the screening for complications, their eyes are screened for the possible eye complications, their screening for the kidney complications is done in urine, that screening is done so that they don't get the more advanced complications that may happen with time if that is not done. So we've talked about their monitoring of sugar, screening for complications is done, and then that they are also screened for the other issues that may come with diabetes. So their pressure is checked, their blood pressure is checked. If cholesterol is there, the lipid issues are checked and they are treated if they are there. And ensure that the average sugar for 3 months is done and that they are within target. So a doctor needs to see them and at least make sure those are in target. Diabetes is manageable, and I think even for your family member, that is something that can be done. And over the long term, if the control is being attained, that ensures that the chance of getting complications from the diabetes is reduced. Yeah.
Okay.
Yeah.
And can they stop medication if they have regulated diabetes or? it seems to be over.
I think what you're discussing is the possibility of diabetes ending, remission of diabetes, and it actually can happen, but stopping of medication would be under the guidance of a healthcare provider, okay. So you would not decide for yourself that the diabetes is over. On what basis? I would recommend let the healthcare provider do it. Some of the things they would be looking at are how your average sugars for the last 3 months are, what kind of medication you are on, because there are some that would need to be gradually reduced to simpler medications and then, stopped. And also what kind of lifestyle changes you've been able to implement, because that is the going forward, if you're not on medication, that is what the treatment you'll be using. Yeah.
Okay.
Yeah.
Thank you, Dr. Nduku. We have to call it a day here. Can you imagine?
Oh no!
It was just getting sweeter, but we have to call it a day here. Many of our viewers are asking where can they get you if they need to reach out to you.
Yeah, so I'm an endocrinologist at KNH, available at the KNH Diabetes Clinic, and I'm happy to engage with you even at that setting. Yeah.
Okay.
Yeah.
And are there clinics around the country where people can get help?
Yes, yes.
Okay.
Right now, diabetologists are a rapidly growing field. Most counties do have, and there are diabetes society groups that have been ensuring that the care provided, as well as guidelines, that the care provided in KNH is the same that is available. Yeah, so whichever is your nearest hospital, I think should be able to give you a good standard of care. Would be happy with that. Yeah.
Okay. Thank you, Dr. Nduku. God bless you so much for coming.
God bless you, Grace.
That was an informative session.
Yeah, thank you. It was so happy to interact with you. Thanks.
Asante. That's all we had for you. I think take home, ensure you go for screening to the nearest hospital, get screened for diabetes. Please look out for those symptoms. Don't assume anything. Rush and be checked. Go ask for an endocrinologist, or you could just start with a physician.
Yes,
you do that check, then can refer you to an endocrinologist for further guidance. My name is Grace Mutiso. It's been a joy to serve you tonight on Health Check. God willing, let's do this again next week on Tuesday, same time, same station. Of course, a different doctor, and we'll be learning together as we grow healthy, both physically and of course spiritually. May the Lord bless you and have a great time. I'll see you next week, God willing, and keep it right here at Top TV. Look and Live. Newswatch is up next after a short while. Bye-bye for now.
Bye-bye.